Introduction. Welcome, medical students, to today's lecture on the topic of inferior vena cava, IVC, filter placement. In our session today, we will delve into the anatomy, indications, types, planning and imaging, procedure technique, complications and management, follow-up and retrieval, evidence-based guidelines and research, alternative therapies and controversies, special populations, multidisciplinary approach, and ethical and legal considerations surrounding this important radiological intervention. Now, let us begin our discussion with the anatomy of the inferior vena cava. In summary, the inferior vena cava is a large vein responsible for carrying deoxygenated blood. It travels alongside the abdominal aorta and has specific landmarks to be mindful of when planning IVC filter placement. Understanding its anatomy is crucial for successful and safe procedures. IVC filter placement is indicated in specific clinical scenarios where patients are at high risk of developing deep venous thrombosis, DVT, or pulmonary embolism, PE, but have contraindications to anticoagulation therapy. Some common indications include 1. Acute DVT with proximal iliofemoral involvement. 2. Recurrent DVT or PE despite adequate anticoagulant therapy. 3. Prophylactic use in high-risk trauma patients with multiple fractures or spinal cord injury. 4. Presence of a large free-floating thrombus. 5. Contraindication to anticoagulation therapy, such as active bleeding or recent surgery. It is important to carefully evaluate each patient's clinical condition and risk factors before considering IVC filter placement, as it carries its own set of risks and potential complications. In the video on IVC filter placement, we discuss the two main types of IVC filters, permanent and retrievable. Permanent filters are long-term and fixed within the IVC, while retrievable filters are designed to be removed once the risk of thromboembolism has diminished. Examples of each type are mentioned. The decision on which type of filter to use depends on patient factors and the potential need for future retrieval. During the pre-procedural planning and imaging phase of IVC filter placement, various imaging techniques such as ultrasound, CT, and MRI are used to assess the patient's anatomy, choose the appropriate filter type and size, and anticipate any potential challenges. This involves reviewing the patient's medical history and laboratory results and having collaborative discussions with the healthcare team. IVC filter placement is done under fluoroscopic guidance using either a transjugular or transfemoral approach. In the transjugular approach, a catheter is placed through a small incision in the neck to navigate to the IVC. The transfemoral approach involves accessing the femoral vein in the groin region. The choice depends on various factors. As with any invasive procedure, IVC filter placement carries the risk of complications. It is imperative for radiologists and other healthcare professionals to be aware of these potential complications and their management strategies. Some potential complications include filter migration, filter thrombosis, filter fracture, IVC perforation, and vascular injury. Filter-related complications may require further interventions, such as filter retrieval, thrombolysis, or surgical management. Prompt recognition, appropriate management, and timely follow-up are crucial for optimizing patient outcomes and minimizing potential complications. For patients with retrievable filters, regular follow-up is essential to assess the filter's position, integrity, and the need for retrieval. Imaging modalities, such as fluoroscopy, CT, or venography, can assist in evaluating the filter and detecting any potential complications. The timing of filter retrieval depends on the individual patient's clinical condition and the risk-benefit ratio. It is important for healthcare providers to communicate with the patient regarding the need for filter retrieval and to provide appropriate counseling regarding the potential risks and benefits associated with filter removal. Evidence-based guidelines play a crucial role in guiding clinical practice and decision-making regarding IVC